Hello everyone, let's try to solve this question together. So here we have a 14-day-old newborn infant who is having emesis. The upper GI study is done, screenshot is shown, and the growth is shown next to it. The infant is in room air and nippling all her feeds. The average is about 150 ml per kg per day. What is the next best step in the management? So 4 choices are given. Zoom the picture. What do you guys think? Okay, the correct response here is discharge home with close follow-up. And of course, in clinical scenarios, sometimes it's difficult to make that such a decision. But let me walk you through. So starting antacid medication. So antacid is really reserved for babies who are having, problems with GER, with the reflux. They are having symptoms, and there is signs that decreasing the acidity would help. So antacids are not routinely used in newborn infant. What about thickening the formula? Yeah, that can work with Emesis. That's not a bad option. But again, infant is in room air, nippling all her feed. So thickening is not like something, I don't want to say the word benign, but it's not like something you do it routinely. And especially this patient, is gaining weight slowly. It's not like the patient is not like failure to thrive. The growth is not going this way. So that's why thickening the formula, you can debate. But I will say that this is questionable. Among the given choices, this is not a bad option. So I'll put a question mark here. So now what about keeping in ICU till emesis stop? This is another option, but this will have a lot of cost issue. Keeping the baby in NICU just for emesis is not the right thing because this could be easily monitored as an outpatient. So the best option here among the 3 is you can discharge the patient home, but with a close follow-up. And you have to counsel the family that we are going to discharge because the upper GI did confirm that baby has reflux and having emesis because of that. Most of the babies outgrow it with time and they start to gain weight. So once they start to gain appropriate weight gain, so suppose the ideal weight gain curve is this way, so ultimately the patient will get there with time. So between C and D, it depends upon the practice. Some physicians or practitioners or provider will feel like I'm not comfortable and I want to keep the baby in an ICU till the emesis stop. If that's a decision, if somebody's taking that decision, then they have to do something about it. Either they have to thicken the formula or go to the second tier and start some medication. You cannot keep the infant in an ICU just to watch emesis without doing anything. This could be easily done as an outpatient. And like I said, it will decrease the cost and it will decrease the anxiety of the family. So I hope this is you guys kind of agree. And see, this is the average weight gain for last 10 days. So it's not that bad. The ideal for a baby who is 14-day-old and let's see the gestation. So gestation is around 38 weeks. So by 38 weeks, about 15 gram per kg per day is the ideal weight, but 8 is not bad. And if you see the total is 16 gram per kg. So it's not that bad. So you can comfortably send the patient home watching the emesis. And this is taken from this article. If you guys have time, read. So see, the median weight gain is around 10 to 12 when the baby, is bigger. For example, this baby is somewhere here. So if you see the curve here, so for a baby who is 36 to 38 weeks, even 10 to 11 gram is not a bad weight gain. And if you see, this is the flat line and infant is gaining weight. So it's not like, you are not comfortable in sending the patient home because of emesis. So basing on this study and clinical experience, you can easily send the patient home. So I hope you have enjoyed the video. Please do like and subscribe our channel, and you guys have a wonderful day. Bye.